Place one hand on the patient's forehead and tilt the head back gently. Place the fingertips of the other hand under the point of the patient's chin and lift. With the index and other fingers placed behind the angle of the mandible, apply steady upward and forward pressure to lift the mandible, whilst using thumbs to slightly open the mouth by downward displacement of the chin. Use a wide-bore rigid suction catheter under direct vision to remove liquid such as blood, saliva or gastric contents. McGill forceps can be used for the removal of solids under direct vision. This airway is better tolerated by patients who are not deeply unconscious, and sizes 6 and 7 are suitable for adults, 6 for a female and 7 for a male. Lubricate the airway and insert bevel end first vertically along the floor of the nose with a slight twisting action. Try the right nostril first. If any obstruction is met, try the left nostril. In the presence of a base of skull fracture, an oropharyngeal airway should be used. This airway is intended only for unconscious patients. Sizes 2, 3 and 4 are commonly available for adults. Estimate the size by selecting an airway with a length equal to the vertical distance between the patient's incisors and the angle of the jaw. Open the mouth, suction if required, and insert the airway upside down and rotate it through 180 degrees as it passes beyond the hard palate and into the oropharynx. Attach an appropriate size face mask to a self-inflating bag with reservoir system and connect to high flow oxygen 15 litres. This will achieve approximately 85% inspired oxygen concentration. It is recommended to use a viral filter between the bag and the mask. Bag valve mask ventilation is better with 2 people. One person holds the face mask in place using both hands and a jaw thrust, and the other person squeezes the bag. This should provide a better seal and more effective ventilation. Try to maintain chest compressions throughout the insertion attempt. Select an appropriately sized eye gel. A size 4 will function well in most adults, but small females may require a size 3, and tall men may require a size 5. Lubricate the back, sides and front of the eye gel cuff with a thin layer of lubricant. Hold the eye gel at the point of the bite block with the cuff outlet facing towards the chin of the patient. Place the patient's head in the sniffing the morning air position with head extended and neck flexed. Insert the eye gel downwards and backwards along the hard palate with a continuous but gentle push until a definitive resistance is felt. Attach the self-inflating bag with viral filter and check for effective chest movement. If available, attach end-tidal CO2 monitoring. Always remember to reassess after every intervention to make sure your airway management is effective. It is important to remember your personal protective equipment. Follow the current local and Resuscitation Council UK guidelines for current PPE requirements for resuscitation attempts.